So Benefits in Action is a Colorado nonprofit organization, and we are approaching our 9th year of service. So we really serve folks all across the state of Colorado, kind of helping them to access, apply for, recertify things like food and health related benefits, financial benefits, so Medicare, Medicaid, food assistance, and so much more.
We have grown tremendously. The demand for our services continues to grow, and we've been fortunate enough to be able to grow our staff and our services to meet those demands.
So our range of services include really kind of a number of things. Benefits navigation really looks like an individual connecting with one of our navigators. We kind of view their personal situation, their income, household size, age, and all those other factors to determine kind of what benefits they may qualify for. So sometimes that's some extra help through like a low-income subsidy for Medicare Part D drugs, or food assistance through SNAP, or even programs for families like temporary assistance for needy families and childcare assistance, and a lot more.
I do intakes of people who come in needing help. I also help with Social Security disability and Social Security income. I started doing this because I wanted to help people who have language barriers. I speak Spanish, and growing up, I translated for my parent a lot. So I know that there's a lot of people out there that cannot speak English and have that barrier, so that's what I'm here for.
Beyond that, we serve folks in 4 metro counties with food box delivery, really reaching those homebound individuals or folks just really struggling to get out and access those healthy food resources. So about every 4 to 6 weeks, we deliver a box of shelf-stable goods with some fresh and refrigerated items as well, and with a smile to make sure that folks are accessing that healthy, nutritious food.
In-house, we probably spend around $6,000 a month, sometimes more, on food that we get from Food Bank of the Rockies. We order directly with them. We also do a tremendous amount of food rescue from Sam's Club, Target. We also go to Food Bank of the Rockies to get extra food from them, as well as different partners out in the community. So we do a lot of food rescue. I would say at this point, probably half food rescue, half purchased food.
Our food delivery program's expanded. We now deliver food boxes to 500 to 600 households a week, which is up substantially from last year. People are hungry. No other way to say it. People are hungry. They need some assistance. Their dollars just don't go far enough to feed their families. Our goal of Benefits in Action really is not to ask people to come to us, but for us to go to where folks are. So our expansion, I think, with different offices, with co-locations, across the Denver metro area. We're in Boulder now, expansion into Colorado Springs, and we have folks who speak probably 10 or more different languages, so folks really can come and work with a benefit navigator in their native language, which makes a huge difference.
I speak Persian, Pashto, Urdu, Hindi, and English, and I have seen it's very helpful to the clients that cannot speak English. I have seen a lot of people like laughing at me when I speak their language because they don't expect me that, I'm one of them. And then I'm like, oh, you can speak that language? Yeah.
The values and the mission of Benefits in Action really align with my own values and mission. I think Benefits in Action is really innovative and, in finding those gaps in like creative and how we can fill those gaps. And that's something that I really think is cool. And having like a pulse on the community.
Benefits in Action is a great organization. It's, giving their time to help seniors and, people with disabilities get the services that they need. We're expanding, and it's just a wonderful organization with lots of volunteers, people that really care about seniors, and they really care about what they're doing and how to help.
There's a couple things I really feel like the people here really do care about people, and they do a variety of services and for the community. Also, I like to engage with the clients. Some people just want to talk sometimes, and I'll take that little bit of time and then really try to get something out. And then there's some that are just really grateful and really need it.
Benefits in Action is grant funded. We operate across 30 plus different grants, and we do receive some funding through the State Division of Insurance, kind of for that Medicare work that we do. We are one of 2 outreach and enrollment partners with the State Human Services Department for food assistance, and really we're always, seeking donations, and we appreciate those kind of, at any dollar amount. We say like $25 can really help feed a family in need.
So my job is to really look at how we can take this entirety of what we do as an organization and diversify the funding so that we can scale it. Right now, we're kind of localized to specific regions for specific programs that are based on grants that we achieve. And I believe from a health equity perspective that everyone deserves access to the level of care and the level of support we give individuals.
We've been grant funded for 8 years, and we're a fixture in the community when it comes to helping people out with their applications and their benefits and what other needs they have. We bend over backwards for our clients to get the answers that they desperately need.